Hey guys, welcome to my YouTube channel. This is Dr.Kishan Shaji Balaram and I am an FMG. I recently cleared my FMG in first attempt with a score of 206 and I'm here to discuss you some things which I did, which are my strategies which will help you to pass a score which is better in getting a good seat in internship. As you all have known that nowadays just passing is just not enough. Getting a good mark will help you getting a good rank during the merit list process and get you a good college during the internship. So let's start. So as I would quote Deepak Marwah sir over here, like, it's not about the number of times you did the revision, it's about the quality of the revision. How much you gave yourself to in it, that is what matters. It doesn't depend upon the numbers, like you did it maybe say 10-20 times, but if you have did it like 8 times and you have did it thoroughly, you have did your MCQs with it, previous year FMGs, previous year NEET, INS side questions also, then that quality is better than just reading your notes for like 10-20 times. And my vision was like a little more simpler version, like one of my teachers, to be specific, Dr.Rajiv Dhavan sir, who teaches me ENT, told me that first, whenever you're studying, it's always good to go for a wide perspective. So what that does specifically is that it gives you a broad idea about your topic and perhaps some details like from where all the questions may come. Sometimes it doesn't, but you'll be on your positive side as to like, okay, if it comes, you will be knowing some things from that topic. So my agenda was clear. I started like a pyramid. The base was pretty big, and as the number of revisions I came, I was going like sharpening my top. That was basically my idea. Like first of all, to go broad, study what all I could have, like all the important topics and all concerning with FMGs, and also NEET and INICT topics also, which were not included in the FMG curriculum. I studied like extra, and as I did my revisions, I just went on for FMG topics which were asked recently. So that topics I kept like a muscle memory to me, so that whenever I got to see the key points in the questions, I could directly go to the answer. Okay, so now let's discuss about what type of education, like mode of education did I choose, and what were my teachers in all these 19 subjects. So I'm a guy that prefers an offline medium of study because I tend to believe that seeing a teacher face to face helps me in better recollecting things to that to that order, because it creates some memory in our minds, and that helps me to create a better visualizing of a topic and gets more connected to that subject also. Because in offline classes, teachers usually tend to explain things in a sort of like a story manner. They tend to connect things with their own personal experience, and sitting there and watching them teach is also like a blissful thing. It's a piece of art. You just have to enjoy it. And I felt like I was that kind of person who needed that offline kind of study. So I went for Medway Institute, which is located in Delhi, and over there I studied the whole 19 subjects with some minor works and tweaks over the some subjects which I'll get into it. So let's start with the subjects. First, the subject was like anatomy and biochemistry. So anatomy, I tend to say this because like everyone has a kind of a doubt like from where we should study. There's like a trillion apps, a trillion teachers who teaches in different ways. So over there in the institute, it was like Dr. Shrikant Verma and I did like his class. I really enjoyed it. It was like a new way, a new perspective of learning anatomy. I would say he had his 3D models and everything. And because of my reasons, like I was like overconfident. Like okay, I studied from him, and I was like, okay, now I know the topic, and I didn't revise it. So for that reason, at the end, like after going into the study of like 2-3 months, I was not able to solve anatomy questions. So I got 3-4 days doc tutorial package, and I took Dr. Azam sir's anatomy lectures, and I completed till head, body, neuro, then neuronat, then head and neck, upper limb, lower limb, stomach, abdomen, and lower limb, like the main important thing. And also I made it thorough that I studied the embryology also, because like a lot of questions are coming recently from the embryology perspective. Maybe it is connected with the anatomy, ophthalmology, ENT. So I made it thorough that I went to that also. So anatomy was from Azam sir, biochemistry was from Azam sir, and internal medicine of course from Dr.Deepak sir. Surgery I did it from Vineet Gupta, because I studied surgery like a half part, like the part 1 book completely from Marwah, Dr. Rohan Kandinwal. But as much as it helped gaining the knowledge, but it was not physically possible for me to complete the whole syllabus in this 3 to 4 months times which I had. So I wanted a shorter medium with crisp and easy way to remember. So I chose Dr. Vineet Gupta over there. And going to gynec ops, I had completely during my university days I had studied it from Dr. Sakshi ma'am, and I went over there. I took my book and went over there. But due to some of my problems, I lost my book which I had written notes and all, and it was like a complete disaster over there. So then in the Institute Medway, Dr.Prassan Vij sir came. So I thought I'll give it a fresh start. I didn't know what was going to happen. It was like a little bit awkward for me, and for me also, like everyone used to say during our study days that we should not change the teacher. We should study from the teacher which we have studied before. Changing the material or changing the teacher will go into like a horrible loop of confusions and doubts and all. So I had that in back of my mind, and I was like, okay, let's give it a try. And I started the class, and it was like, he is a great man indeed. He was like explaining all the topics like in a very crisp and easy manner, and I really loved him. He was like, he's best in like clinical all stuffs. He's working in St. Stephen's Hospital, and he used to show us, tell us his experience, all the cases which came over there. So for me, who have not gotten any clinical experience of that kind, or haven't able to see any cases of that kind, helped me a lot to visualize that, okay, the patient comes to us with this, and you're a doctor, you have to do, primarily you have to diagnose, like you have to, okay, then you have to ask certain questions, then you have to like come to a diagnosis. So it was really informative, and also an eye-opener, like to how to be a doctor in fact. And I'm really grateful to sir. Because of that, my gynec and obs were really strong. I could like complete over 70% whenever I did GTs and all. I got gynec level was more than 70%. So next, let's get into Patho-Micro. Patho-Micro was undoubtedly from Dr. Preeti ma'am. She has a special way, like she uses a lot of mnemonics she makes into a story, but I really like to stress in this point that the only thing that I remember during my exam was her stories, and because of that I could solve like a lot of questions related to micro and patho. I mean, sometimes like there's a saying that the more words the mnemonic is, the better chances of you remembering, and it was like point on. The mnemonics were like in a story, like for example, what do you say, trichomonas vaginalis. Yeah, she made it into a story, like and it was just great. Now, okay, next subject was Derma. I did it from Dr. Akhilesh Raj. He came to Medway, so I just went for there. Derma was a subject that got a little bit that I was a lot of bit concerned in the last days, because I saw some rapid vision videos and I was like, okay, many of the topics which I haven't seen at all were discussing, and I was a bit little scared. Then I did previous and all, and I did the NEET and ionized PYQs, and it gave me a little bit of confidence. Okay, this much is enough. If something comes out, I'll just blindly go for any options. Then forensic Akhilesh Raj sir. The mnemonics were hard to like remember for me, because I'm from Kerala and most of the mnemonics were in Hindi, so remembering that and coping with that language was a little bit difficult, but I made sure that I made it. And then there was like surgery I told, yeah. Okay, physio was from Akhilesh Raj sir. Then next subject was anesthesia was from Jhanvi ma'am. Pharma was from Dr.Ranjan Patel. I liked his book. His book was like very crisp. The main benefit of learning from his book was that everything was in a single page. So I devised a trick which I'll share in my next video. So how to study pharma. Okay, and his book was like crisp. Everything was in a single page, and in the first page he made us draw a diagram to conceptualize what should be the main idea while studying these topics. So it was really helpful. And the next was psychology. Psychology was from Dr.Akhilesh Goel. He was also a very good teacher. Ophtha from Dr.Shivani ma'am. Shivani ma'am like really felt like a mother to me over there, because I was away from my home and I felt little homesick, and ma'am was there to help. Like during the time of study, my grandfather also due to diabetes had some complications in his eye, you know. So ma'am really helped me like understanding what was the issue and all, and I'm really thankful to ma'am. The next subject was anatomy, biochemistry, ortho from Dr. Abbas Ali, the bone teacher. I had studied his rapid revision videos during my university times, but the way he did the offline classes was a really fun way to interact. He had these mini tests sort of a kind, and in that there was like a 15 seconds or 10 seconds to answer a certain question, and there was like a point, so it made the studying part a little more fun. And I guess that's all for the subjects. What are all there after completed? Pediatry from Dr. Sandeep Sharma. He's like he's like a perfect cricketer in his terms of language. Like, we should always finish the game with a good over. That is what he tells. his book was really useful, like and the way he teached, like it was simple, crisp, and for a person who didn't study pediatry in his university time that well, it was really more than enough to go with Dr. Sandeep Sharma. And yeah, so that's all for pediatry. And what next? Yeah, I think I have covered most of the things. If anything else is there, I'll just add it over here, the list, and in the descriptions also you can see I'll give all the subjects and teachers. And the main strategy for me was to do, like, if I studied 10 to 5 pages a day, I made sure that I did that MCQs at that time. Like I used Marrow's question bank and I solved that particular topic's MCQs at that time. And after 2-3 topics, like 15-20 pages, I made it sure that I completed the PYQs. I didn't wait so that all the subject completes out, then I'll do the PYQs, so I'll get a little confidence. It's all about your mindset. See, if you keep your mindset like a little positive and be in a way let's see what happens, just give it, okay? And also give grant test. Yeah, I'll be doing a video very soon depending on the main strategy, like to how to give GTs, when to give GTs, and what all should be looking into while giving your GTs. And like we should also make an LMR, last minute revision book, which also I'll be discussing in the next video. And that's it. Thank you guys for listening out. This is me signing off.